And Japan is now the newest to join a growing list of places taking action to slow the spread of Omicron. They include Hong Kong, the United Kingdom, India, and Israel.
And let's take a live look at the White House, where the president will soon be addressing the nation on action the United States will be taking today to control the new variant. Just hours ago, President Biden was briefed on the Omicron variant by his COVID task force in the Oval Office.
Lindsay Ward joins us live in the studio with what the administration is putting into effect today.
Yeah,
Lindsay?
This is something that I think a lot of people are certainly concerned about and don't know much about at this point. But the president is expected to talk more about the U.S. restricting travel from South Africa and 7 other countries. The World Health Organization has labeled this newly discovered strain as a variant of concern. It was first detected in South Africa, and they stress that more research is needed to determine whether the variant is more contagious, if it causes more severe disease, and whether it could evade vaccines. A growing number of other countries are trying to figure out how to deal with this new variant as well. In fact, at least a dozen countries have confirmed cases of the new strain, and several others are reporting suspected cases.
If you're going to do the travel ban the way we've done now and that we're implementing right now, utilize the time that you're buying to fill in the gaps. And by time biding, you learn more about the virus, you learn what its relationship is to the antibodies induced by vaccines, and above all, you use this time to really put your pedal to the floor and get people vaccinated and get people boosted.
Now, locally, doctors have told KDKA it's not unusual that there is a new COVID-19 variant, as it's common in viruses, but there's still a lot that we simply just do not know much about this one. And doctors say what we can do now to protect ourselves is to get vaccinated and keep up with that mask wearing. And like I mentioned earlier, the biggest concern is we just don't know how strong of a strain this is, and if it can really be okay when it comes to being vaccinated and how it might impact you if you get it, all those sorts of questions.
I think that's one of the biggest questions. Like, are the vaccines we currently have
are they strong
going to take care of this?
Yes, exactly.
We're hearing about a lot of people who are vaccinated getting infected right now and coming down with COVID. So, all right, Lindsay, thank you so much.